So in this video, I'm going to cover everything about coffee, the benefits, the potential downsides, and then how to even potentially eliminate those downsides. Okay, so coffee we know that it contains caffeine, but it also contains many other compounds. So it is the actually largest source of antioxidants for the average American. And really where most of the benefits of coffee stem from, we think, is the chlorogenic acid in the coffee. Our body will convert that to caffeic acid, and then it will further convert that caffeic acid to something called ferulic acid, okay, which is a very powerful antioxidant. Now, coffee needs to be individualized because there are fast metabolizers, people who metabolize it very quickly and won't have as many side effects. And then there are people who are slow metabolizers who will metabolize caffeine very slowly and they will have more adverse effects. So you really need to understand how coffee affects you personally, and that will really determine what the optimal amount is best for you. It could be none, it could be 6 cups of coffee per day, depending on what activity you're trying to perform. So we know that coffee, it improves athletic performance, it improves cognition, it improves the ability to complete mental tasks. Most people understand that. From a looking at the prospective studies and observational studies, somewhere between 1 to 4 cups of coffee is associated with lower risks of cardiovascular events, all-cause mortality, dementia, things like that. Even reductions in type 2 diabetes and other disease states. Now, that cannot prove causation, right? Because these are observational studies, but as a source of antioxidants for Americans, it being the number one source, it makes sense that it would have some benefits. Now, there are also some people who do not tolerate coffee very well at all, and it can have actually a lot of negative consequences, especially when it comes to acid reflux. Okay, some people have silent reflux on coffee, where they don't have any pain in their chest or any heartburn per se, but they have a lot of chronic thick sticky mucus in the back of their throat that's constantly getting stuck there, and that's called water brash, and that can be due to reflux induced by coffee. So coffee is very acidic, especially, and then when you drink it hot, that can worsen acid reflux. So people who are suffering from acid reflux may benefit from lowering their coffee intake or consuming colder coffees, or just simply eliminating coffee altogether. Now, we've talked about some of the benefits of being an antioxidant, the associations with reductions in disease states. Again, can't prove causation, but there is some decent data that the antioxidant properties of coffee may have some benefits. And we know from athletic performance and mental acuity and things like that, coffee and caffeine can have benefits, right? But let's talk about some of the potential side effects. So coffee is essentially a nutrient depleter. Both minerals and vitamins can be depleted. Now, this doesn't necessarily mean that it's going to cause any clinically significant harm in someone, especially if they're only consuming 1 cup. But people who are consuming 4, 5, 6 cups of coffee per day, this absolutely can be a potential issue. And there are ways around it that I'll teach you guys. So the biggest nutrient that coffee wastes is salt. There are 3 ways that coffee will deplete salt from the body. The biggest way is through the urine. So it's called a natriuretic. That's what coffee is. It eliminates sodium, and it's also a chloriuretic, which is an elimination of chloride in the urine. So 1 cup of coffee will cause you to lose about 437 milligrams of extra sodium out the body through the urine. 2 cups will be 600 milligrams. 4 cups will be 1,200 milligrams. And then 6 cups of coffee can cause someone to lose 1,800 milligrams of sodium. Now, to give you perspective, 1,200 milligrams of sodium is a half a teaspoon of salt. So if you consume 4 cups of coffee per day, most people need an extra half a teaspoon of salt just to replace back what's lost in the urine. There is an increased loss of salt, sodium, and chloride through sweat when you consume coffee and caffeine by 15%. So if someone loses, let's say, 1,000 milligrams of sodium per hour, when they're consuming coffee or caffeine, and it obviously depends on the dose, on average, they're going to lose an extra 15% of salt through sweat. So that's the second mechanism of how coffee or caffeine depletes salt from the body, is by increasing the loss through sweat. The third way that coffee and caffeine reduces salt from the body is it inhibits the absorption of sodium and water. So there's an increased 24-hour loss of sodium out in the feces, so gastrointestinal loss, by about 22% when you consume coffee or caffeine. And there's about a 15% increased loss of water through a decrease in absorption through the gastrointestinal tract when you consume coffee or caffeine. And of course, this will depend on the dose too, but that's about on average. Now, this makes intuitive sense, right? Most people who consume coffee have to go to the bathroom. They got to, there's an increase in stool production fairly quickly. And that's due to the increased loss of sodium in fluids as well. That's how coffee sort of causes that. So that one makes intuitive sense. So those are the three mechanisms of how coffee depletes salt from the body. So one way around that would be to simply consume salt, electrolytes, and fluid 30 to 60 minutes prior to consuming coffee. Okay, that makes sense. So that way your body absorbs it all, and then having coffee 30 to 60 minutes later, that will help you to absorb the salt in the fluids better, get you hydrated back from, overnight, not consuming salt and fluids for a while, and then having coffee. And this will actually, delaying the coffee a little bit too, may actually improve the 2 p.m. slump. But really, I think more the benefit is that it's allowing you, by delaying it and consuming salt and electrolytes first, is allowing your body to be more hydrated right away in the morning. And that's just going to help you mentally as well, performing mental tasks and things like that. Now, the second nutrient that's depleted from coffee is taurine. Now, taurine gets reabsorbed in the kidneys following sodium. So by coffee kicking out sodium, it's reducing your body's ability to reabsorb taurine at the kidney level. So we don't know exactly how much taurine needs to be consumed to offset it, but I take an extra gram, 1 to 2 grams of taurine per day for this reason, but also really for the benefits of taurine itself, from blood pressure as an antioxidant, and particularly for eye health. My family has a history of some eye issues, so taurine is important for eye health, and that's also why I take taurine. So the other nutrient that can be depleted from coffee is called vitamin B1 or thiamine. So coffee and caffeine, particularly coffee though, can break open the thiazole ring on thiamine and inactivate it. So vitamin B1 is important for carb metabolism, fat metabolism, protein metabolism, athletic performance, mental health, etc. So coffee breaking open that ring and inactivating vitamin B1 is not good, and it also inhibits and reduces the absorption of thiamine. So simply taking thiamine prior to coffee, about 30 to 60 minutes prior, or 3 to 4 hours after coffee, is a way around that. Or taking certain forms of thiamine where that inhibition or breaking of the ring would not happen would be taking something called allithiamine, sometimes called all-thiamine. I take that via the Fullscript link in my bio, but that particular form of thiamine, which is thiamine tetrahydrofurfuryl disulfide, TTFD, also called all-thiamine or allithiamine, that particular thiamine you can take with coffee, and it doesn't appear to break open any ring or inhibit thiamine absorption via that form. The other nutrient that is reduced with coffee is iron. So a lot of women have iron deficiency anemia. Some of that might be due to not getting enough copper and being able to move around the iron in the body, but also some of that might be due to the fact that they're consuming coffee close to their iron meals because it inhibits non-heme iron absorption. So basically spacing iron foods from coffee is an important point as well when it comes to iron deficiency anemia. So consuming iron foods an hour before, 1 to 2 hours before, I would say coffee, or consuming it 3 to 4 hours after will help reduce the reduction in iron absorption with coffee. So the other point is that some people feel very jittery on coffee, and something called L-theanine at 200 to 400 milligrams can sometimes help that jitter.